Under the new health care law that was recently signed into law by the president, children now can stay on their parents' insurance policies until the age of 26. People can no longer be denied coverage for pre-existing conditions. Insurers, the big insurance companies, are prohibited from rescinding coverage if a customer becomes sick, and they can't impose any lifetime limits on essential benefits like hospital stays or expensive treatments. You say you want to repeal all of that?
Well, first of all, no one's disputing that our healthcare system before Obamacare didn't need reform. Those are very important things that are part of insurance reform, not healthcare reform. In the course of the public debate over healthcare reform, we've begun to confuse coverage with care. Our goal should be to make health care more affordable. So what I want to do is to fight to fully repeal that so that we can begin to enact real reform. And that real reform would include allowing policy portability when you change jobs, allowing Delawareans to get policies across state lines. Right?
I support the implementation of the Affordable Care Act. I think it made significant advances, and you outlined many of them. But there's additional investments in the bill to make sure that there's a breadth of coverage to rural areas through the Health Services Corps, by recruiting and training a whole new generation of doctors and nurses, by expanding support for community health centers, and by also improving the efficiency of our healthcare system. It's not perfect, there's problems with it, but I think rather than turning it back and repealing and going for another year or two of endless partisan bickering, this was a critical piece of legislation. Not a pretty process that passed it, but I would stand for it and implement it responsibly.
Well, we're now into the part of the discussion on it. So let me just ask you that the issue was brought up about malpractice reform. And Democrats are often accused of being too close to trial lawyers, and Republicans say that's why that there has not been the opportunity for reform in this area and why it was not included in the health care bill. If you were elected, would you work to amend that bill to include malpractice reform?
I think it is critical that folks in this country be able to stand up to and take on powerful interests, and where individuals are harmed, that they're able to go into court and to seek redress, whether they're harmed by someone who misled them in a securities investment, a product that they purchased that hurt them because it wasn't designed or delivered right, or a medical procedure that went horribly wrong. I don't support putting caps on liability because I frankly think in our current system, it is only the threat of a significant recovery that allows protection for consumers, for patients, for investors. I frankly think that's an important part of the American legal system. I don't know what reports you're reading.
You say that it's partisan bickering, but 1 out of 4 Democrats have gone on record saying that they oppose Obamacare. They've realized that we made a bad mistake. And what this bill does is it gives a massive government control over health care. Uncle Sam has no business coming in the examination room, coming between you and your doctor, and that's exactly what this bill does.
Give some concrete example of how. That's a great slogan. You toss it around everywhere you go. But how does this bill actually put Uncle Sam in the examination room between doctors and patients? And if so, why did the organization that fights for and represents America's nurses, America's seniors, America's hospitals, and America's doctors all endorse and support this bill?
And many of those branches on the state level, including here in Delaware, have said that we don't support what the national office has done.
You oppose the government mandating that everyone must purchase health insurance. Is that right?
Yes, because we're confusing coverage with care. Our goal needs to be to make health care affordable.
All right, well, here's the question. Let's say someone decides not to purchase health insurance, makes that conscientious decision, even though this person can't afford to buy health insurance, but decides doesn't want to. This person gets critically ill, is rushed to an emergency room. Should we, people who pay for health insurance, provide him or her with that kind of treatment, or should we kick him out of the emergency room, said, you made a decision, you're not going to get this kind of treatment?
If we do the things that I said that will help to address, that I'm proposing, that will help to address the issue of health care, then that person can afford to buy a catastrophic only policy from across state lines. They'll be able to...
But what if that person doesn't want to buy it?
Well, then we have to address that.
Who should take care of that person in an emergency?
We have to address that.
Would we, all of us taxpayers, have to pay for that person?
Anything that they do when they have another bill that they can't pay, make them pay it. Hold them accountable for that.
Before or after they get care?
Right now, well, that's up to the hospital. But right now, we're forcing them to. We're forcing them that they have to give care to illegal aliens. So this is something that we're already doing. Well, nobody should be forced to pay for anyone else's health care, and that's what Obamacare is doing.
And that's what's happening today. Before the health care reform bill passed, all of us who have health insurance, who have health coverage, have been bearing the costs, paying the freight for those who don't have insurance and who don't have coverage.